Good afternoon, everyone. My name is Mary Jo Kennedy. I'm the Director of Community Engagement, and I'm excited to welcome everyone to our volunteer training. Some of you on the call have been involved with us as outreach volunteers, so welcome back. And to those of you who are new volunteers or who are exploring the opportunity to volunteer with us, we're glad you've joined us. We are excited to talk about a unique volunteer experience where you will be empowered to engage your friends, family members, and local community to make a difference in the world of breast cancer. This evening, I'm joined by Dr. Susan Love, President of the Dr. Susan Love Research Foundation, who I will introduce shortly, and Jenny Grimes, our Community Engagement Manager, who will be presenting this evening. In the past, our outreach volunteers' role was to recruit women and men for the Army of Women program. We're excited to let you know that we've expanded this role, and as an outreach volunteer, you will be empowered and supported to talk about the Dr. Susan Love Research Foundation and our programs, which include Army of Women, our Health of Women study, and our in-house research. We will share with you the steps to become one of our STAR volunteers and how to connect with local events, learn some best practices this evening for social media, and hear about some real-life scenarios. This is a great way to start off the new year, so thank you all for your time this afternoon and tonight, depending on where you live, and throughout the coming year. Before I introduce Dr. Love, I do have a couple of housekeeping items. All participants will be placed on mute, so if you would like to ask a question, please type it into the text box to the right of your screen. It's in the lower right area of your screen. We will have a Q&A at the end of the presentation, so all of your questions will be answered then. And we will also have a couple of polls that we will be sending out during the presentation. So we really encourage all of you to participate in the polls. So at this time, I would like to introduce Dr. Susan Love, President of the Dr. Susan Love Research Foundation. Welcome, Susan.
Thank you, and welcome to all of you. I'm so excited to join you. This has been my first week back at work since my bout with leukemia, and I'm very excited to be back in the saddle. I'm doing very well and feeling stronger than ever. And one of the things that really has happened to me over the past 6 months with this experience is it's made me feel even more powerfully that we have to focus on finding the cause of breast cancer and of cancer in general. Because the treatments, as probably many of you know, have so much collateral damage and so many side effects that they really are not the goal. The goal has to be not to get it in the first place. And that's the goal of the Dr. Susan Love Research Foundation. We really focus not on doing what everybody else is doing, but trying to figure out what people are not doing that they should be doing. You know, what kind of research isn't happening? We've noticed that a lot of the basic research, the research trying to figure out the cause or looking at different molecular markers, is all done on laboratory animals, on rats and mice, which is all well and good, but they don't get breast cancer. We have to give them breast cancer in order to study it. And we want to do more research on women, people who actually get breast cancer. And that's part of the goal of our Army of Women program. In addition, we want to find the cause of breast cancer. Too many and too much of the focus is let's find a way, targeted treatment, or a way we can treat it, or a better way we can find it. Well, I want to find a better way we can just stop it and not have it in the first place. And that is part of our HOW study, which is really looking at can we study women and compare the women who get breast cancer to the women who don't get breast cancer, and therefore figure out what the cause is. So we look for areas that we can uniquely make a difference, that are not the same as everybody else out there, and where we can really move things forward. We're in this really to come to the end of breast cancer. We're not in it for anything else. And we really hope you'll join us, that you'll volunteer, you'll become part of the Army of Women, part of HOW, because it's going to take all of us together to really find the end of breast cancer. I was about a year ago giving a talk at a group of researchers, and I said we really have to stop talking about researchers, patients, advocates as if they're in different buckets, as if they're different groups of people. And I said really the only difference between a researcher and a patient is a diagnosis. Little did I know that 6 months later I would have a diagnosis myself. But it just made me feel even stronger that this is something we have to do as a team. It's not let's raise money and hand it over and let the scientists take care of it. It's something that we have to be part of the research, we have to be the guinea pigs, we have to come up with the ideas, and we have to all work together. And I think we can all work together, because only by all working together will we really get rid of breast cancer once and for all. Now with that, I'm going to pass this on to my wonderful team. And next we have Jenny Grimes, who is our Community Engagement Manager, and is going to explain to you a little bit more of the mechanisms. I'm the big idea, how are we going to end it person. The rest of the team is the one that makes it happen.
Thank you so much, Susan. Thanks for being on the call this evening and sharing your vast experience with us all. Again, my name is Jenny Grimes, the Community Engagement Manager. It's a pleasure to be on the call with you all this evening. We're going to start the presentation with focusing on the mission. At the Foundation, we like to start all of our meetings with the mission, as it really grounds us to the reason why we're all here. So, the mission of the Dr. Susan Love Research Foundation is to eradicate breast cancer and improve the quality of women's health through innovative research, education, and advocacy. So we always think it's really important to start here and just really ground us as why we are all here and why you are all here tonight on the call as well. So what do you need to know about breast cancer? Breast cancer is the second leading cause of death among women in the United States, with over 280,000 women diagnosed and some men with breast cancer each year, a number that hasn't budged or changed much since 1992. 108 women will die of metastatic breast cancer every day, and the majority of women who are developing breast cancer have none of the currently known clinical risk factors, and we still do not know what causes breast cancer or how to prevent it. These are some very important numbers to be aware of in terms of breast cancer, and again, another reason why we are all gathered here. Leading the way, we understand that there are many breast cancer organizations out there doing great work in the field of research, education, and outreach, but we really want to show you what it is that makes us different and unique in this field. To date, $4 billion have been raised for breast cancer research, awareness, and education, but the number of women dying from breast cancer has changed very little, and we still do not know the underlying cause of breast cancer or how to treat it. The role of the Dr. Susan Love Research Foundation is to continue to be the only freestanding breast cancer organization so heavily invested in the research process. In this way, we can prevent breast cancer and really search for the cause. So you can just see the ways that we're looking at things differently. We really like to think outside of the box here. So our focus is really finding the cause of breast cancer. So our work really falls into 4 distinct categories: conducting our own breast cancer research in collaboration with some of the top researchers from across the country. No other freestanding breast cancer organization, again, is so heavily invested. And we really work with our donors and partners to fund research that is changing the research paradigm. Facilitating research, we have our Army of Women program. Since 2008, the goal has been to recruit over 1 million women. And we'll go in and talk a little bit more. I'm sure we have some members on the phone with us today. And also the HOW study, the Health of Women study, where we'll be collecting health and exposure information over time to understand potential new risk factors for breast cancer. Also our website, www.dslrf.org. This site is a wealth of information. It's the breast book almost come to life on the web, so feel free to check into that with any other information you may have as well. In volunteering with any organization, it's always important, I think, to see the financials behind it, where the money comes from, where the money goes. So on this slide, you can really see where the money is coming in from. It's important to see also our special events income, that little blue slice of the pie, because we're really hoping in 2013 to see this explode and grow, and we're going to host an upcoming webinar in 2 weeks that we hope you all will join us with to learn more about that. So if we move further, we can see expenses. Where does the money go? Here at the Foundation, we continue to spend over 85% on programs and research. Again, research, with less than 15% used for operations and fundraising. This is a great way to really see where does the investment go. The focus of our work can really be seen here in finding the cause, identifying risk, and improving prevention and treatment. The 3 ways in which we do this are the Army of Women, the Health of Women, and in-house research. So we're going to go ahead and break that down a little bit more for you. So let's start off with the Army of Women. And at this time, we're going to invite you all on the call to do a poll with us. We're going to see how many of the members on the call right now are already a part of the Army of Women. And for those who aren't, we'd love to strongly invite you to join us at armyofwomen.org to be a part of that. So we're going to go ahead. That poll is open. So you can just click there on your screen, yes, no, not sure. We're just gathering the results here. The Jeopardy timer is going off. All right, a few more seconds. And thank you so much for your participation. So it looks like about 75% almost of those on the call are already members of the Army of Women, which is fantastic, and we thank you for already being such strong supporters. For those who aren't, we'd love to educate you a little bit more about that and just invite you to join us. So what is the Army of Women program? Click back on the slide. There you go. All right. So it's an online initiative. We're really working to connect women with or without a history of breast cancer to researchers to participate in studies, look into the cause and prevention of breast cancer across the country. To date, we have recruited over 370,000 volunteers to be a part of this program, and that's growing every day. The history of the Army of Women is that it was originally this great program, this outside-the-box idea that Dr. Love thought of, was shot down and poo-pooed for a long time and told that it just wasn't going to work. This idea was finally officially launched in October of 2008 thanks to a grant from the Avon Foundation for Women. And again, we have women of all ages and ethnicities making up a part of this great program with the goal to encourage all women, again, with or without a history of breast cancer, to take the next step in breast cancer advocacy and to participate in research studies. So this is really connecting and making the bridge for women to get into those research studies and fill those and close those, because we need people in the studies for us to be able to do that research. So this program really allows that to happen. So this is how it works. It's a very simple process, very streamlined. Women, and again, men, sign up to receive emails of all available studies, and just very basic demographic information is collected at that point. Call to action emails are then sent out to the entire database when an improved study comes available. And if you fit that study, you just connect with a quick yes, click to armyofwomen.org, that's available in that email, and then you undergo a secondary screening. So this really allows you to forward that email on to you, to a friend or a family member if it doesn't apply directly to you. Again, over 370,000 participants. And I think it's really important, if you look on the left side of your screen, to note that over 70% of those in the Army of Women do not have a history of breast cancer. So personally, as a breast cancer survivor, I just find that amazing that there's so many other women out there stepping up to really support and connect and make that army around us. Okay, moving on then. So for the Army of Women studies, we've been able to connect and enroll over 81,000 members of the Army into studies, with 4 international, 28 national, and 38 regional studies. We've been able to successfully close 48 studies through 70 call to action emails. This is great success of really moving women into research studies. You can see here that there are women from the Army of Women across the country. This is as of June 30th, 2012, including Alaska and Hawaii. And we also have some international participants as well. We have some in England, Scotland, India, and even tonight on the call we have those calling in from over 18 states. So thank you all for being a part of this movement. The Health of Women study, we're going to go ahead and check in and do another poll with you now. So you can pop back on your screens. We just want to see on the call how many so far have participated in the Health of Women study. So give us just a second. Oh. I think we got this backwards, it looks like.
Oh, we did.
Well, let's go ahead and we'll do this the flip-flop way then.
Yeah, so it's going to say Army of Women member, but it's really have you participated in the Health of Women study. I apologize. I got it mixed up.
Okay. So if you can take a second and just vote on that then. Great. And we'll go ahead and wrap that one up. And again, sorry for the mix-up on our end. And we'll go ahead, we'll explain a little bit about the Health of Women study. It's a new program just launched here October 1st of 2012. And we'll look at the results. It looks like there are 50% have completed the Health of Women 32% know, and some are not sure. So we'll pop into that and learn a little bit more. Let's hide that. Hide it. There we go. All right, so the Health of Women study, again, was launched October 1st of this year and is open to the whole general public. Participation is quick and easy. It's just online. And through this, we're targeting all women, any ages, with a history of breast cancer or not. And this is a longitudinal study that's going to collect information throughout your lifetime. With all of this data, researchers are really going to be able to understand why women continue to get breast cancer or not, and ways to stop it and analyze that data. So the Health of Women study, again, has already gained over 34,000 women signed up and submitted the first questionnaire. If you haven't joined us already in this study, hopefully after the call you can just pop on to healthofwomenstudy.org and complete that then. And if you have any questions throughout the call, again, just plug them into the chat box, and we can answer those at the end. And any that we don't get to, we will definitely email you personally and answer those for you. This time we're going to discuss in-house research and turn that back over to the expert. So I'd love for Dr. Lev to come back onto the call for us and discuss that further.
Hello, I'm back. You know, as you can see, we try to get everybody involved in this, and we try to make the researcher's job easier and make it easier for them to move from rats and mice and laboratory animals into women by supplying eager women ready to go. We do our own research when we can't find anybody else to do it, like the HOW study, where we're comparing people who got breast cancer to people who haven't, and we're getting a lot of interest from a lot of other researchers who want to look at specific populations that might give us a good idea. And we're also opening up the HOW for questions you might have thought of. You know, with the cancer of the cervix, one of the ways they figured out that cancer of the cervix was sexually transmitted was that people started noticing that there were these men whose first wife died of cancer of the cervix, and then their second wife died of cancer of the cervix. And they said, maybe it's him. And that was the first clue. So those kinds of clues you could come up with as well, and maybe we'll figure out breast cancer from one of you. And in addition, we try to do research that that nobody else is doing that we think might be an important clue. And an example of that is our focus on the breast. There seems to be a lot of focus on molecular biology and genes, but we really don't have yet a good understanding of how many holes there are in the nipple, how many ducts there are, whether breast cancer is just one milk duct or all the milk ducts. And we've been trying to do research both to map the anatomy and also to figure out what's going on in the breast ducts. Most currently, we thought we would look and see whether there are any bacteria or viruses in the breast ducts. You know, we know that a lot of cancers are caused by bacteria and viruses. Cancer of the cervix, cancer of the liver is caused by a virus. Cancer of the head and neck is a virus. Some of them are bacterial. And it certainly is possible that an organ like the breast that gets sucked on by lovers and babies might have bacteria or viruses living in the ducts. You can see on this picture, you see the breast, and you only see 2 ducts opening in the nipple, but there are about 6 to 8 of them. Any one of you that have breastfed know that it looks like a watering can. It doesn't look like it looks like a watering can, not a hose, when you're breastfeeding. And what we're doing is collecting fluid from these ducts by massaging the breast and then looking to see what bacteria and viruses live there. Now, in the past, when people tried to do that, they would just put it on a Petri dish and see what grew. But the problem is then you have to have the right conditions for the bacteria and the virus to grow. And so what we're doing instead is we're mapping the RNA and DNA of everything that's in the ductal fluid. And then you match the DNA against the list of the DNA of all the viruses and all the bacteria that we know about and say, oh, these are the guys that are there. Very CSI, actually, approach. But we're about halfway through recruiting our subjects, and we're looking for both women with breast cancer and women who don't have breast cancer who live in the greater LA area. And then we'll do our analysis, and we certainly, as we always do at the Foundation, will report the results directly back to you as well as report it in the scientific literature. If we do find bugs, then or bacteria or viruses, we'll we'll move on to see, are they more in one kind of group or another kind of group? Do they really predict who's going to get cancer? And it'll take us down a whole other route where hopefully we'll be able to get a lot of other researchers excited in this arena. So this is the kind of exploratory studies that we do, the kind that nobody else will do, and hopefully if we find some interesting results, we can then get other people to carry on.
That's wonderful. Thank you so much for sharing that information. I always just love this picture, and just hearing it just always really amazes me. So, and one of the great things again about being at the foundation is that the research is being done here within the office. It's not a big institution or anything. It's just there's people in scrubs next to my cubicle. So as we're presenting this, it's pretty amazing. So it's very tangible, the research that's being done. So we're going to go ahead and just look at next steps, what you can do in all of this. We've kind of given you a 411 about what we do, and just the information that you can share with your family members. If you're at a family barbecue or having a Super Bowl party, you can definitely share this information and what are the next steps you can do to really move this forward. And as a volunteer for us, how you can make that difference in your community. So some different great ways to really take the next step is to research and attend events in your area. You can Google these events, look for statewide events that might be happening at your local hospital, any women's business events. We have a whole criteria that we're going to email out to you after the training. But we also have some events that we will email out to your local area, and you can let us know if you want to participate. You can plan or host your own outreach event, or you can also just spread the word to your family, friends, coworkers, Pilates teacher, anyone you have in your community. So to plan an outreach event, you really can just host that at your house. You can host that at a yoga studio again, all sorts of different options. We had two great ones recently. One's coming up in Arlington, Virginia, Peace, Love, and Chocolate, where Holly's opening up her home and inviting in a representative from the foundation to really educate, sign people up for the Army of Women, and just really explore kind of what that means to people to start finding the cause of breast cancer. Another was a concert that was done by Lori Morgan here Lori Montgomery here in California, who is undergoing breast cancer treatment, and just really invited us to the event to spread the word about the Army of Women. So if you have an event going on, you just would love us to have a table or some sign-ups and just let the word get out about the foundation, we would love to attend or have some of, just invite all of our volunteers to be a part of that. So just let us know if that's going on in your community just through a quick email, and we'll have that contact information available for you at the end of the call. You can also spread the word virtually. This is probably my favorite way to do it. We understand you all have very busy lives with work or kids, or I know I have a dog I have to get home to at the end of the day. So what are some just different ways that you can really easily connect? If you have a Facebook account, a Twitter account, we would love for you to dedicate your status to us, such as think fast, how you can make a difference today. Start your day today by making a difference in breast cancer and posting the Health of Women link to your page. Invite all of your friends and family to sign up to be a part of that, offering them bonus karma points for every sign up that they do today. Just really quick ways to engage your friends and family in our mission. You can also email an invitation to your friends and family through the tools that we have available on our website. And again, that's dslrf.org. You can also just pass it forward, our way of saying pay it forward, just by forwarding any of those emails that we may send to you on to family or friends. You know, we hear a lot that there might just be a study available here in Southern California or one in New York City, but if you receive that email and you know your cousin is based in New York City, go ahead and send that on to her, but also really get the network growing in your community. And the Health of Women study is wonderful because it's available nationally. Every single person, with or without a history of breast cancer, anywhere, even internationally, anywhere, the whole globe is invited to participate in this. So please join us. You can spread the word in your community. This is a volunteer of ours just last weekend at the Brides Against Breast Cancer event. She just was able to get some great sign-ups and spread the word again to a whole group of women at that program. You can also just spread it to any local colleges you have in your area as well. Excuse me, it's the end of the day here in California. And what is your volunteer impact? Our innovative volunteer program empowers you to make a difference both in person and virtually within your community. You can do this in honor of breast cancer survivor or the memory of a loved one, support innovative breast cancer research, receive recognition, create lasting memories, meet some new folks you'll be volunteering with, and really make an impact in the field of breast cancer. So how does your investment help? We can kind of think of this in 3 different ways that you're really investing yourself. Invest your dollars, invest yourself, invest your friends. Invest your dollars is any possible contribution or donation you're able to make to the foundation. Investing yourself and your friends is what we're really focused on this call. Investing yourself is through the research. By signing up to be a part of the Army of Women and also completing the Health of Women study, you're contributing your history, your breast cancer experience to researchers. Investing your friends is just that pass-it-forward mentality, just really collecting your community and rallying around this cause together. And here at the Foundation, we love to support the impact you make. We love busting out the streamers and the confetti. So we offer a volunteer appreciation program with great tools, tips, trainings, any ideas that you may need along the way. We have team retreats and strategy sessions to really help you brainstorm on what you would like to do specific to your community to help with any events or anything coming your way that you can come up with. We have monthly webinar trainings such as this one that you're on tonight, and we thank you again. And we also have a quarterly newsletter, tools and tips, and we really like to recognize our volunteers with our Star Volunteer program and offering other little goodies along the way. So it's the creative, fun part of our time here, so we enjoy that. So to become a part of our program, we'd love for you to email me, Jenny Grimes, here at the Foundation. It's jgrimes@dslrf.org. And that can be for any questions you have, any materials, anything you saw tonight on the slide, anything that's confusing. I've been here for about 6 months, but I've been a breast cancer survivor for about 5 years now, and again, back in treatment. So I'm full of resources, both personally and professionally. So we'd love for you to send me any questions or comments you have, but also to invite you all to please join us for our upcoming fundraising webinar. That's going to be focused more on the fun and fundraising and just some different fun events that you can do along with that. So we'll be sending out invitations to your inbox with that soon. With that, we're going to open up any questions that you may all have. These can be anything your heart desires. Dr. Lev will bring her back on the call. And so feel free just in that chat box on the lower right-hand portion of your screen to any questions you may have about what volunteering means, what you could do, any breast cancer questions you may have, please let us know.
Thank you, Jenny. And this is Mary Jo again. And I just want to, again, while we're waiting for some questions, to thank everyone for being on the call tonight and listening and hearing about our organization as a whole. And that's the great opportunity as a volunteer in our outreach field of volunteering, is just going out and really talking about the organization as a whole and all of the great things that we're doing. It's really exciting time for us here at Dr. Susan Love Research Foundation, and we've got some really, as Dr. Susan Love said earlier, outside the box thinking and really moving it forward and being the leader in the field of trying to find the cause of breast cancer. So we truly appreciate all of you for being on the call this evening. So let me look and see if we have any questions.
This is your big chance.
Okay, here we go. So hold on, let me move this up. And we do have some great questions, so Jenny's going to read them. And all right.
All right, Dr. Lev, they want, Arlene wants to know, are you doing any research on DCIS?
Ah, a subject close to my heart. We've been trying to get funded, actually, to do a project that I really want to do on DCIS. One of the big problems with DCIS is, it's when the cancer cells are stuck in a milk duct and they haven't gotten out yet. And we don't know, some of them may develop the ability to get out and other ones may just sit there for the rest of your life. And so it'd be really good if we could know both which are the bad kind and which is the good kind, and also how much DCIS is there. Right now we see it with microcalcifications on a mammogram, but the calcifications are only in one little spot. And the DCIS may extend throughout more of the duct. You remember that picture of the breast duct that we showed with different branches. Think about branches of a tree. So if we could tell how much there was, then we could actually start to look at other ways of treating it. Watchful waiting, if it didn't look too bad, where you'd get an imaging study once every 6 months or once a year and see how you were doing, and only if it kept growing would you do something. Or maybe we would give a tamoxifen or Herceptin or some kind of drug, and you wouldn't need surgery, but it would turn it around and you could monitor it. Or even if we had to cut it out, if we knew exactly how much there was, we could cut it out precisely as opposed to just taking out a section of the breast and hoping we got it all. So this is a project we're very, very interested in working in. We're looking for all kinds of partners from, companies. I've had some preliminary talks with General Electric to scientists. We've got some people at Rutgers who are in Columbia and New York who are interested in working with us. And we're hoping to be able to develop this project over the next couple of years. It's something that we could get an answer to really quickly, and it would change women's lives immediately.
Wonderful. Thank you so much for that. Just to let you all know that this is being recorded. We will have it up on our website as well as on our Facebook page. And again, you can send any questions. We can also send that to you over email as well if you need that. Moving on to another question. Let's see. I'm sorry. Got a little mixed around. All right, Dr. Lev, even though we absolutely want to prevent breast cancer, what can we do to help those with MBC now?
Well, I think that's as important a project, obviously, as preventing it altogether. There is, luckily, research now going on in this arena. The National Breast Cancer Coalition has a very large project they're working on in terms of relooking at metastatic disease. And the most interesting thing about it is one, we're finding out that not every cell that gets out of the tumor and maybe can be found in the bloodstream actually survives to become metastatic disease. I live in California, and I always say it's as if just because the cell gets on the freeway doesn't mean it's going to make it to San Diego. It might have an accident on the way. And the second part we're finding is that metastatic disease needs a certain neighborhood for it to flourish, and that there's another kind of local neighborhood, other cells around it, that can keep it under control. So if we could figure out a way to keep any cells that have gotten out of the breast under control and dormant, then really, and there's some interesting new research in this arena coming out of some of our collaborators, such as Pat Stieg, who's on our scientific advisory board, that really are very promising in this regard. So the goal may not be let's kill everybody, but let's sort of change the neighborhood, win the hearts and minds, go into the villages, bring them into, and change the way they behave so that the cells just sit there quietly and are happy. And, if they're not giving us any trouble, then we don't care so much that they're there.
Great, thank you.
Okay, Dr. Lev, we have another question for you. Also, what are your thoughts on cancer vaccines, those in clinical trials and the clinics in foreign lands who offer vaccines for a lot of money?
Well, the concept of having a vaccine for cancer is one that really there's a lot of interest in right now. There is a large project also out of the National Breast Cancer Coalition looking for a vaccine for breast cancer that I'm part of. And part of it would be, if we found a bug, a bacteria or a virus that caused cancer, then you could have the kind of vaccine that we give for cancer of the cervix or for the flu. On the other hand, if it's not caused by an infectious agent, there's still the potential of developing a vaccine by finding something in the cancer that you can make the immune system see as abnormal and knock off. And there's a lot of attention going on in this arena as well. So it's an area of interest. It's an area that a lot of people are thinking about. At the moment, I don't know of any vaccines that have been demonstrated to be effective yet in women. there's one going on in DCIS that has some promise. There was a great one that went on in rats or mice with lactoglobulin, but I haven't seen it in people. And so it's still early days, but it is an area of interest, and it is an area of a lot of attention.
Wonderful. Thank you for that. All right, I'm going to have to direct this question to Mary Jo. Can we find out if there are already volunteers in our area or be able to contact them?
Absolutely. So if you want additional information, if you can email Jenny at jgrimes@dslrf.org, and we will definitely connect you with the other volunteers in your area.
Great. Thank you. Okay. All right. Dr. Love, why isn't triple-negative breast cancer routinely checked to see if it is basal? The conferences I've attended, the doctor states that knowing whether triple-negative is basal would give them information to treat more effectively, but testing is not routine. Why is that?
Well, you know, at least the meetings that I have been to, the basic scientists who are doing the DNA analysis think that they can show treatments that would be more effective with basal, but not all of them have actually panned out the way they anticipated that they might. So the PARP2 inhibitors are an example where everybody was very excited and thought that they might be good for triple negative and for basal, and some of them are and some of them aren't, and it's looking a little more complicated. And so the reason it's not being done routinely outside of the research arena is because the information on the treatments that they would use, quote, targeted treatments, isn't really strong enough to go that way. It's potential, and I think, you know, somebody who was diagnosed with triple negative should definitely look into what studies are available and what research, because they could maybe find other options or new options that might not be as available in their local vicinity. In addition, one of the things that I think we often forget about triple negative, and for those of you that don't know, those are cancers that are estrogen negative, progesterone negative, and HER2 negative. So they're not triply bad. They just have 3 negative markers. And it turns out they respond the best to chemotherapy of any kind of breast cancer. So in some ways, that's a positive. And there are other breast cancers, certainly the luminal A's, that chemotherapy is worthless for. So so the triple negative is not, you know, it sometimes gets a bad rap as being, you know, a death sentence. It's certainly not a death sentence. It's just that it doesn't have a targeted treatment yet that has been demonstrated to make a major difference.
Great. Thanks, Dr. Love. And we have had a couple of people say they're wishing you well, so I wanted to share that with you. They're sending lots of good thoughts your way.
Well, I will take all the good thoughts I can get. I have a lot of work to do, so I got to get this out of the way.
That's right. That's right. We're glad you're back, though. So here's the next question. There is news of a new method for detecting ovarian cancer cells within the cytology collected in a pap smear for cervical cancer cells using gene expression analysis. Can you comment on this and how this method might be or is being used for breast cancer?
Well, this is a new thing. It just came out yesterday, I believe, that you could use pap smears not just for cervical cancer, but also for ovarian and uterine cancer by looking for the cells. Whether the fact that you can, as the question sort of makes you think, is it worth it? And the problem with ovarian cancer is that it's not very common, and so if you were going to analyze the DNA of all the cells in every pap smear, you would be doing really a huge number of exams to find one case of ovarian cancer. So I think that there may be better approaches to do this, but the way technology goes, you never know. I mean, before we know it, we'll be, you know, using our cell phone to I just saw a thing where you can use your cell phone as a microscope. So we might, the technology may be such that it can be done easily and cheaply, in which case it would be a great idea. In terms of breast cancer, there are people who have looked for markers in the blood and urine. Thus far, we haven't found one that really is reliable enough. We've also done a study in China where we're looking at, can you look in the ductal fluid? Can you massage the breast and get a few drops of fluid out and then look for markers in that fluid as a predictor as to who's at risk and who needs to be monitored more carefully. We showed that it works. You can get the fluid. Women will do it. You can do a dipstick and see if the markers are there. The next step for us will be launching a larger study where we track people over time and see whether this technique actually will predict who's going to get breast cancer. But I think we desperately need not just finding cancer, but if we could do a better job at figuring out who is biologically at risk, who is not just the standard risk factors of when you had your first kid and how old you were with your first period, but actually what's going on in your body, whether it's looking at something in the pap smear or looking at something in the ductal fluid, then we could focus our screening, whether it's going to be mammograms or MRIs or something else, on a smaller group of people who are more likely to be the ones that really need it. Right now, we're doing it on so many people, and the majority of them are probably not going to get cancer. So we need a way, I think, to really figure out who are the ones who are in fact at risk and focus much more concentratedly on them.
Great, wonderful. Another question, Dr. Love, this is from Peggy. Adjuvant Online gives a percentage advantage of taking chemo plus hormone therapy. How does one find out how much of a percentage radiation would add?
Okay. That's a good question. Well, first, the most important thing is radiation and surgery are done to prevent the cancer from coming back in the breast. And chemotherapy and hormone therapy are done to prevent the cancer from coming back somewhere else, or if there are cells somewhere else, to take care of them. So what adjuvant is telling you is what's the effect of taking hormones or chemotherapy in terms of living or dying of breast cancer. And what the radiation would tell you is what is the chance of having it come back in the breast if you do or don't have breast cancer or have radiation. There may be a website for that. I'm trying to think, but I don't know it off the top of my head. So I'll do a little search and see if we can find it, and then we'll put it up on the website for local control. But the big thing is the radiation. The big thing that people often get confused about is radiation is not going to really make a big difference in terms of living and dying. It's going to make a difference on does it come back in the breast or not.
Okay. All right. That's great information here tonight. I want to thank you all for your questions. We greatly appreciate it.
Any questions that we didn't answer on the phone, we definitely will follow up with you and respond to those questions. We have sent a short little email to you, so hopefully you got that. And
yeah, I just want to thank you again as somebody living with breast cancer. Just your participation in helping us to find the cause and the end of this really greatly means a lot to us and the entire foundation.
And we hope you all will join us as volunteers. We're excited to continue to expand the program. So we appreciate your support. And Dr. Love, thank you so much for taking time to share with us all of your knowledge and your enthusiasm and motivation. It's truly infectious.
Well, we have a lot to do, and we can only do it if we all work together. So join us, and we're determined to get rid of this disease and make it history so that our kids and the next generation won't even know what it is.
Yeah, I agree. Great. Thank you so much, everyone. Have a great evening.
Okay. Thank you.
Bye-bye.
Bye.